This video will guide a technician on how to properly run through all the steps in a measurement. If the patient's information is already stored in the database, you will begin by selecting the name of the patient and then click on the tab Add a Measurement. If the patient is not in the database, then you will need to add a new patient by clicking the Add a New Patient tab. Complete the form with the patient's name, gender, EMR, AIR ID, address and/or the work address, phone number, email, occupation, and insurance policy name and number. Then enter the patient date of birth, year, month, and day, and then click on the Continue tab. If the patient has no contraindications to run the test, click on No and then click on the Continue tab. If you click Yes to any contraindication, a message is then displayed indicating that the test cannot be run. Be sure to correctly complete the clinical context to help the physician to better interpret the exam results. Click OK on the message, and then enter the height, weight, and activity level of the patient. It is optional to enter some lab test results, and you can change the units. Click on the box Symptoms, Conditions to select the patient's symptoms. If the symptoms are not the checklist, you can write a short description of other symptoms on the 3 bottom boxes. Click on the box Disease to select patient diseases. If the diseases are not the checklist, you can write a short description of other diseases on the 3 bottom boxes. Click on the box Treatment to select patient treatment. If the treatments are not the checklist, you can write a short description of other treatment on the 3 bottom boxes. Then, click on the Continue button. Step 1 Patient Setup. The patient is lying down. Select the type of measurement, complete test, or only lower extremity, pseudomotor, and ankle brachial index measurements. Choose the right size of the cuff, and if necessary, select for one missing extremity. Review the images on the screen to ensure that accessories are properly placed on the patient. Then, when the patient is ready to test, click on the Continue button. Step 2 Checking the device connections. If properly connected, the 4 checkboxes turn green and read OK. The oximeter starts, and the window will automatically move to Step 3 of the measurement process. Step 3 Baseline Measurement. Pseudomotor and photoplethysmography records. This step takes 2 minutes to be completed, and you can see on the software the remaining time. Instruct your patient to relax and not move during the measurement. If the waveform on the screen is irregular because the patient is moving, you can restart the measurement. Click once on the white button of the black, green, and gold blood pressure devices, and then OK. Wait for the synchronization of the 3 Bluetooth connections. The volume plethysmography and change of pressure for each device is displayed. Phase 2. Right arm and posterior artery of the ankles. Rotate the right and left ankle cuffs so the blue arrow will be aligned on the top of the posterior arteries. Click once on the white button of the gray, green, and gold blood pressure devices, and then click on the Continue button. Wait for the synchronization of the 3 Bluetooth connections. The volume plethysmography and change of pressure for each device is displayed. Step 5. Cardiac autonomic reflex tests. Place the patient's finger back in the oximeter and then click on OK. Remove the foot disposable electrodes and ankle cuffs. The patient should be in a reclined position at 60 degrees. Phase 1. Valsalva maneuver test. Please read the warning and contraindications of the Valsalva maneuver. This phase can be skipped if the patient has any contraindication, otherwise follow the instructions displayed on the software. The technician will hold the manometer during the Valsalva maneuver. Click on the Start Test tab when the patient is ready to blow in the mouthpiece of the manometer. Phase 1. Valsalva Maneuver Test. The patient blows in the mouthpiece until reaching 40 millimeters of mercury. For 15 seconds, the patient should blow and maintain the pressure between 35 to 45 millimeters of mercury. The patient's RR intervals, perfusion index, SpO2 percentage, systolic pressure, and heart rate are displayed in real time. This section can be restarted if the patient has a delay in blowing into the mouthpiece. If the patient SpO2 fails under 94%, there is warning message. If it fails under 90%, stop the measurement immediately. Phase 2. Deep Breathing Test. If this phase is skipped, then the cardiac autonomic reflex tests cannot be completed, and the software will display the exam results and this section will not be available. The technician instructs the patient to inhale and exhale in 5 seconds intervals. Click on the Start Test tab when the patient is ready to perform the test. Using the timer, the technician must guide the patient regarding the sequence to inhale and exhale. RR intervals, perfusion index, SpO2%, systolic pressure changes, and heart rate are displayed in real time. This section can be restarted if the patient has a delay in the sequence. If the patient's SpO2 falls under 94%, there will be a warning message displayed. If the SpO2 falls under 90%, the measurement will stop immediately. Phase 3. Stand-up test. Postural change. The technician instructs the patient to stand up progressively. First, the patient will sit up from the supine position, and then the patient will stand up and remain standing. Click on the Start Test tab when the patient is ready to stand up. RR intervals, perfusion index, SpO2%, systolic pressure changes, and heart rate are displayed in real time. If the patient SpO2 fails under 94%, there is warning message. If it fails under 90%, stop the measurement immediately. Near the end of Phase 3, a blood pressure measurement is performed. Click once on the white button of the black blood pressure device. Once 0 is displayed on the device screen, and then click OK. At the end of the measurement process, the results are displayed automatically on the computer screen. To print the report, click on the tab Print. Select the different options, PDF, Cloud, or Email, and report ID by name, HIPAA, or IMER ID. Then, click on OK. Then, select the report type. Select the patient report and pages display in the report. Then, click on the Continue button. The patient report comprises different assessments: overview, cardiac autonomic, pseudomotor function, endothelial function, blood pressure analysis, ankle brachial index, and lifestyle. A main markers overview page and a comment page reviewed and updated by the physician. To print the wellness suggestions, click on the icon Print, select Wellness Suggestions, and then click on the Continue button. The Wellness Suggestions report comprises a summary of the results and scoring trends, A wellness plan includes a suggested plate portion, weight management and scale of minimum and maximum calories, suggested level activity and supplements, and personalized diet based on the patient results. To print the trends, click on the icon Print, select Trends, and then click on the Continue button. In case of ankle brachial index normal or borderline, and if the patient has symptoms of claudication, you can run a post-exercise measurement. The patient must perform 5 minutes of exercise, and then immediately a new measurement can be run. Select the patient's name, add a new measurement, click OK, and then a message opens. Do you want to run a post-exercise measurement? Click on WES and follow the software instructions. The pseudomotor, volume plethysmography, and blood pressure changes for each device are displayed. Now, rotate the right and left ankle cuffs so the blue arrow will be aligned on the top of the posterior artery. The volume plethysmography and change of pressure for each device are displayed. At the end of the measurement, the results open. Click on Print icon, select Patient Report, and then click on the Continue button and the report opens. Please contact LT Technology for any question at 305 379 9900 or by email contact@lttech.com for any questions. Thank you for your time.